I am thrilled to be back on AJ Plastic Surgery TV, home of plastic surgery. First of all, I'd like to pour out my heart to thank everyone for the engagement, for the feedback, the likes, and the positive and negative criticism that the channel has received. I've been away for a minute, and today I want to come back and introduce a topic that is really dear to us, a topic that is number one in the region, I can even say in Africa, and that is breast reduction. So what is breast reduction really? So breast reduction is a procedure that entails reduction of breast tissue, at the same time mold the breast to be as near normal. Why do we do breast reduction? So breast reduction is indicated where you have both physical, psychological, or what you can say psychosocial distress or pain in a patient that has an excessively enlarging breast. Or in other words, you can say the symptoms that present are directly associated with the size and the growth of the breast. The common presentation of what we call macromastia or gigantomastia is one. Obviously, an excessively enlarged breast associated with pain, back pain, neck pain, shoulder pain, or a combination of all the three. Other common presentation is difficulty in carrying out daily activities or activities of daily living. For example, cleaning up, moving around. So you find that because of the weight or the load on someone's chest, they cannot easily move around or achieve the activities. Other symptoms include psychosocial, or what I call psychological and social distresses. For example, you have low self-esteem because you'd find a patient that has come to you and that person is defined by their breast because they are obvious. They'll say, when someone look at them, instead of looking up, they look around the chest area. So that comes with a lot of psychological anguish, self-doubt, increased self-awareness that really disturbs the person who has the enlarged breast. Apart from that is what we call social or stigma, societal stigma or pressure. So you find people associate large or breast growth or large breast to behavioral. For example, someone can be so falsely accused of being promiscuous because they have big breasts at early stage, especially around the teenage or just after teen. If a young girl has excessively enlarged breast, they automatically assumes that they are sexually active, which in most cases is not true. So when you have a combination of physical and psychological symptoms, and they are directly correlated or associated with the enlargement of the breast, then such a client is a candidate and qualifies for breast reduction surgery. So how do we do breast reduction surgery? So breast reduction surgery is done under general anesthesia, meaning we completely put someone down to sleep, and then you reduce three things of the breast: reduce the skin, the fat, and the gland itself. So what are the steps for you to take once you realize that you are a candidate for, or you feel that you're a candidate for breast reduction surgery? So number one step is consultation. You have to see a board-certified plastic surgeon to screen you, meaning we take relevant history, rule out any underlying medical conditions so that we can optimize you for a procedure. After you're done your consultation, then you have to do what we call baseline test. Check your blood levels, check your kidney function, liver function, and your fitness for surgery, because this is going to be a 3-hour surgery. Then once you've done your consultation, you've done your basic investigation, then you schedule you for a procedure, because this normally is an elective. It means it's a scheduled procedure. It's not done as an emergency procedure. The procedure day, you do a further evaluation. Now we review with your test, a laboratory test, and then you go for theater. The surgery itself usually takes about 2 to 3 hours. Then after surgery, you're admitted for a day or two, then you roll over to postoperative care. Postoperative care takes a average of about 2 weeks, during which you're going to do change of dressing. What it means, you have to address the incision site so that you heal well without infection, without scarring. Then after that, 2 weeks down the line, once 2 to 3 weeks down the line, after you are done with your dressing, then we do continuous or self-scar management. Because what we aim after you're doing your breast reduction surgery is to try and make sure the scar heal without leaving a huge mark, so they fade as much as possible. So what are the common questions that I usually get in my consultation room for a patient who wants to do a breast reduction? Number one is ability to breastfeed. So most of the patients who want to do breast reduction will have that thought or question: what happens to me? What happens to my baby after I've done my breast reduction? Have you taken away my ability to breastfeed? Do I need to supplement? Do I need to give formula for life? My simple answer is no. The ability for a baby to latch onto the breast is maintained after breast reduction. What varies is the quantity or the volume of milk let down. So the milk let down can remain the same, can reduce, and actually in some instances can increase. For example, if you had a huge breast in your first pregnancy and you had minimal milk let down because of the tissues compressing on the ducts, so that means milk could not come out. When you do breast reduction and reduce the volume of that tissue, so you free the ducts, the milk ducts, and then in the subsequent pregnancy after breast reduction, you can actually have increased milk let down. In some instances, when you had a normal milk let down during the first pregnancy, then you opt to do a breast reduction. In the subsequent pregnancy, actually the milk let down can be reduced if large volume of breast reduction was done. And in some instances, if you've done your breast reduction and then in the first pregnancy you had a normal milk production, you can actually have same milk production in your subsequent pregnancy. Number two, nipple sensation. Nipple sensation is very, very important for after breast reduction, and the techniques that we try to do is to try and do preservation of nipple sensation. In fact, right now we don't talk about nipple survival because it is assumed as a surgeon you have to do all you can to ensure that there's nipple survival. And if you cannot guarantee, or the breast is too big that you cannot guarantee nipple survival with the conventional method that you use, meaning a pedicle, then you have to do what we call a free nipple graft. So with that, the discussion has now turned to nipple sensation. And from our experience, nipple sensation most of the time is preserved. However, in a small population of patients, around 10 to 20% will have delayed recovery of nipple sensation after breast reduction, especially if you're doing massive reduction to the tune of reducing 4 to 6 kilograms per breast. Number three, scarring. Anyone would want, and for African population, we have very bad scarring. We form hypertrophic scars, we call what we call keloids. So patients who come to my consultation room, really, I'm worried about the obvious scar, which someone can tell that they have had something done on their breast. So my answer to that is that yes, it is practically impossible for you to have surgery without scarring because we are cutting. So anytime someone cuts your skin, invariably you're going to have a scar. So the difference is what is the degree or what is the appearance of your scar. What we do for us to improve the appearance of the scar is to do active scar management. When does it start? It starts in theater. So the technique that we're going to do when you're doing your reconstruction, the dressing that we're going to do, and the post-operative care, and then subsequently during maturation of scar, which takes up to 2 years, what intervention are you doing to ensure that you have improved scar appearance? The biggest misconception we have around breast reduction is that breast reduction procedure is purely cosmetic. And women who come for breast reduction surgery do that out of, let me say, vanity. That is the word. It's a very sad story It's a very sad story, and in my experience, I've seen patients who've suffered for a very long time, over the years, from puberty to even their 50s, late 40s, and no one has offered them an option of breast reduction or encouraged them, and sadly some of them have even been discouraged from doing breast reduction procedures because it's thought to be plastic surgery, and meaning cosmetic surgery. So to really debunk that myth, that misconception, is to say that breast reduction is a reconstructive procedure, is a necessary procedure because there's an indication, and a clear indication at that. I have really enjoyed today's discussion because it's very passionate. It's what really I'd like to talk about and put it out there. I hope you've enjoyed, and what I'm promising you is that what is coming is more such like a discussion, and I'd really like to hear your feedback, your comments, your questions, so that I can respond to them in the subsequent videos, because we really have to talk about the stigma and the misconception around breast reduction procedures. So please like, share, subscribe to AJ Plastic Surgery TV for more content.